To a child, even the littlest of things can make the biggest of differences in their world. And that's never more true than when a child needs treatment for a chronic illness. It's a hand to hold, a joke to tell, a sticker to make it fun, when it's anything but. It is infusion therapy and dialysis. It is 26,505 needle pricks into 800 tiny arms. It is 3,400 infusions. And it is over 106,000 hours spent by hundreds of children and their parents in a cramped 363 square foot room at the Infusion and Dialysis Center each year. We're providing the best care for our patients, but with a little more space, we can do even bigger things for our children.
The past 20 years has seen an explosion of disorders that we take care of at Connecticut Children's Medical Center that involve disorders of the immune system and chronic inflammation. For me in particular, as a pediatric gastroenterologist, that means disorders called inflammatory bowel disease. Whereas 20 years ago, we might take care of 20 new children per year, we now see 80 to 100 new children per year. Fortunately, new therapies have also been developed during this period of time, but they're not given as pills, they're not given as liquids, they're given as intravenous infusions.
Currently in the state of Connecticut, there are no pediatric dialysis facilities. Many times when we're talking to our families, they're devastated to hear a diagnosis for dialysis. But what's even worse is that they can't stay here. They have to travel all over the state to get dialysis.
And those infusions may require time in the hospital ranging from an hour up to a full day.
When our daughter was diagnosed with Crohn's, our daughter Alexandra, she was just 2 years old at that time, so it was a pretty big surprise and pretty big impact on our lives. We learned we were going to have to move on to Remicade, and that was a big step for us. That would have to be through an infusion, and that is not easy for anyone, let alone a child who was just 3 years old. Each room had 3 patient seats with 1 seat for a caretaker, and there's equipment. And as we went through the 2 rooms, my husband looked at me and said, well, I'm not going to be able to be there. I can't do this with you guys. Because my husband's 6'4½", and we were both concerned about crowding other people out. And the way we're seated now is the way we were always seated, because we had to not only conserve space, but I needed to provide her with as much comfort and comfortable seating as possible, because the infusion process always began with about 8 to 10 minutes of loud crying and screaming, because it was not an easy process. It's painful.
Currently, when I diagnose a child with end-stage renal disease and they need dialysis, it's like a 1-2 punch. First, I devastate the family by telling them that their child needs dialysis, and second, I follow with, but you can't get the care here. You have to travel across the state to adult centers with adult patients in large chairs. No bubbles, no games, no child life, no developmentally appropriate toys. They have to go in these chairs for 3 to 5 times a week for 3 to 4 hours. I can't get my kids to sit for 5 minutes, let alone hours, to get the life-saving treatment they need without the appropriate staff. One of my patients that I hold near and dear to my heart, his name is Daniel. He has something called prune belly syndrome, and by 18 months of age, he needed dialysis. He had to travel all over the state with his mother to get the dialysis care that he needs. Imagine, he was sitting in a large adult chair at 18 months of age for hours to get dialysis. His mother had to get him to sit still. She had to tempt him with toys and treats and tricks, and all of that was on her. Fortunately, we were able to get Daniel the kidney that he deserved. Now he's doing all the things we expect children to do. He's walking, he's talking, he's pulling our hair. With this dialysis center, you will prevent me from telling the next family, yes, your child needs dialysis, and I'm so sorry, you cannot come to Connecticut Children's to get the care that you need. I don't want to do that again. I want to be able to care for them here in our hospital with our amazing staff who know exactly how to make children in Connecticut the healthiest.
The space that we currently use is the same one that we used in 1997. It just simply doesn't work anymore. There's no privacy for our patients, it's not effective or safe for the caregivers, and it needs to be changed. And that's really the whole point of moving forward with the new infusion center. For these children to have a new and improved space in order to receive their life-saving therapy.
We will be able to service children from all over the state with developmentally appropriate areas as well as the best of care clinically for them, where they and their families feel completely safe and comfortable during these very difficult procedures that they must undergo.
The little things make all the difference. To us, and to our children and their families. The new Infusion and Dialysis Center at Connecticut Children's will bring all of those things together in one amazing place.